This segment sponsored by the Springfield Clinic. Well, for this week's Wellness Wednesday, we have Philip Jostes. He's a registered occupational therapist with Springfield Clinic's rehabilitation services. We're talking about hand therapy, something I've never heard of before. And guess what? We have a pro and expert to tell us what it is. Good morning, Philip.
Good morning.
Yeah, so tell us, what is hand therapy?
So our hand therapy clinic here at Springfield Clinic is a little bit of a misnomer. Our team of occupational therapists and certified hand therapists are specialized in orthopedic and neurological injuries of the entire upper extremity. So all the way from the shoulder to the hand, we treat a wide variety of conditions, including acute injuries such as fractures or sprains, chronic injuries, including arthritis and tendinosis, and even a lot of post-surgical recovery and wound care. The hand specifically is pretty dynamic, and it's a complex structure with a lot of moving parts, a lot of joints, tendons, muscles, etc., all in a relatively small area, and that can complicate recovery even from mild injuries. And so that's where our team of certified hand therapists come in to decrease the recovery time and maximize functional return to your daily activity.
Really, really interesting. Now talk a little bit about, obviously this time of year is probably a busy time for you, maybe an increase in injuries with falls or people shoveling their snow.
Yeah, definitely. We have seen a handful of, no pun intended, of injuries due to people falling on the ice, breaking their shoulder all the way down to their fingers or their wrist or something like that. We even get some overuse injuries. Maybe laborers are out shoveling snow or working in these cold conditions, and can even develop such conditions like frostbite or things like that. So yeah, we are a little bit busier this time of year.
It's something that certainly I've never heard about, but certainly that's needed in our community. How does a patient maybe get access to your services?
So they can be referred by a physician, either their primary care doctor, or even maybe if they're established with an orthopedist, then they can always get a referral from them. If they're not established with a doctor or have not seen anybody for maybe a new injury, they can always come to our orthopedic walk-in clinic here at 800 North 1st Street in Springfield, and no appointment is necessary. They can walk right in and be seen by a physician and get referred to our services if necessary.
Well, we thank you so much for your time. And of course, you can always visit Philip at those offices that he just mentioned. And I thank you so much again for being here today.
Hey, no problem.
All right.